Welcome to the Transformation Education Series. My name's Pete Wisniewski, and I'll be your host through these webinars, study groups, and live seminars as we explore the stress response. We are a national organization consisting of amazing world-renowned speakers with decades of experience in both patient care and teaching professionals to understand and apply functional medicine in their practice. Our group of educators have experience in a diverse subset of functional medicine, including endocrine balance, natural cardiovascular support, natural fertility and preconception planning, practice management, Western herbs, and whole food nutrition. We welcome you to join hundreds of healthcare professionals listening in on this webinar, replays, and live events to understand how individuals adapt to stress over time. We begin our second webinar of the series with Dr. Annette Schippel, an enthusiastic speaker who has treated patients for over 16 years. Dr. Schippel has traveled the world teaching thousands of practitioners about functional endocrinology and its application for the patient. She has taught over 60 seminars across the United States and has written numerous manuals and programs used by clinicians implementing this type of work. When she's not speaking, you can catch her at her thriving functional endocrinology practice in Southern Illinois. Now remember, during this webinar, you can type questions in the chat window, and she will do her best to answer them at the end. And keep in mind that if you are new to this material and do not have a good evidence-based survey, we will offer you a free endocrine stress survey PDF that you can use to start this work.
Thanks, Pete. Today's webinar topic, it's just a little sugar, exploring the adrenal, liver, and pancreas triad for blood sugar balance. So what we're going to be exploring today is some of the statistics, a little bit behind what goes on, how our body regulates blood sugar, how these glands contribute to it, and also some assessment tools that we can utilize in our office pretty easily to highlight issues early on with our patients so we can start, helping them now before it progresses, to something, much worse, such as type 2 diabetes or so forth. But before we go a little bit further, I wanted to talk about just some of the statistics that are out there to highlight that, it's not just a little sugar. And this is becoming a really big problem in our diets and in our day-to-day thinking. And, up until recently, there wasn't even an RDA listed about on any label with how much sugar you were getting in. It'll show the sugar grams, but it would never say, oh, this is, 150% of the RDA or 20%. There was nothing on there. It was just list of sugar. And a lot of people, believe it or not, they would look at that and think, oh, okay, there's no percentage, and maybe just not correlate it with I'm getting too much, or this is an insane amount of sugar in this product, or what have you. So Forbes did a report in 2012, and they were kind of looking at the increase of sugar consumption was kind of the big overview of it. But they were going back as far as 1822. Now, I think this would obviously be back before we had all the processed foods and so forth. But the average American back then consumed 9 grams of sugar per day. Relatively low, especially when you consider one teaspoon of sugar is equivalent to 4 grams of sugar. So that means they were having about 2 teaspoons of sugar per day. Now, fast forward to 2012, and they found that the average American was consuming 153 grams of sugar per day. That's obviously, it's a long time, but that's an insane increase of sugar. Then in this report, the American Heart Association was talking about, what their limit is and what they recommended. And what they had found today is that the average adult consumes 88 grams of sugar per day, and a child consumes a whopping of 128 grams of sugar per day. This is on average. Now, if we really want to put that into perspective, here's what the recommended limit is, or the RDA, of sugar consumption for an adult male. It's 37 grams. For an adult female, it's 25 grams of sugar per day. And for children, 12 grams of sugar per day. And yet our average is for an adult, 88 grams. That's, 3 to 4 times higher than we should have. But what about children that are only supposed to have 12 grams of sugar per day, and yet the average now is 128? It's astounding. It's actually disturbing if you think about it. But it goes back to not being aware. And that's part of what this series is about is first part is to create awareness. And that's really what we want to accomplish with this first webinar, is giving some really good tools so we can create this awareness. Did you realize that like a simple juice drink that actually is not from concentrate, a lot of them have anywhere from 35 grams of sugar upwards to 50 grams of sugar in a typical serving, that a child would just drink the whole thing, let alone a soda that could have anywhere from 40 to 55 grams of sugar in just 12 ounces. So you can see, if we're not aware, we're not paying attention, it's very easy to exceed those limits. And it really is about changing our thinking about it. It's not just a little sugar is okay, because that just a little sugar has turned into 10 times the amount that we used to ever have, and 4 to 5 times more than we should. So let's just go a little bit further and see how we can assess our patients and have a little bit better understanding of this triad that has an impact on our blood sugar. With that, it's easy to see that pretty much anybody who walks in your door probably has some sort of blood sugar issue, whether that's struggling with low blood sugar or actually getting into increasing problems with more of a hyperinsulin or a functional insulin resistance, where they're trending towards diabetes. When you consider that 27% of the population has undiagnosed diabetes, that means 1 in 4 people are walking around with diabetes that's yet to be diagnosed. And another staggering statistic is that now adolescents account for 35 to 40% of all new cases of type 2 diabetes. Adolescents. So we have that group of population that doesn't even know that they have diabetes, and yet we have our adolescents making up a huge percentage of all new cases. So one of the places we can certainly start, and of course, I'm bringing in the adolescents as well, but it all starts at home. So we have to get our parents, our adults aware. But you can use the endocrine stress survey as a jumping off point to create that conversation with the patient about what's going on. Because the truth is, you may be the only one looking for it, especially if what they're experiencing right now are some key symptoms, but it hasn't manifested into abnormal lab work. If it hasn't manifested into abnormal lab work, that's not going to be caught by anyone else. And that's why, we say here that, by the time their primary care physician may intervene, they could be that 27% that already has diabetes. And we don't want that. We want to be there sooner. We want to help them, catch it, more quickly. But we have some really good tools that we can utilize. So when do we start blood sugar lifestyle changes, and how do we enter into this conversation? And one of the key places we have to start, and I know for all of us, here, this is a bit of a no-brainer, but it has to start with the diet. Because if you cannot create the dietary changes, if you cannot move them through that, all the stuff that you could possibly throw at them or think you're doing really good, and they may be really great choices, might be using some herbs like gymnema, and you're utilizing magnesium and maybe chromium and all this other great stuff, but without the diet changes, they're just not going to be as effective. They're not going to have that impact that we need. This already happens too much. I see it all the time where, a patient might be having a conversation with me about the medications that they're on, and I might say, well, was any dietary changes discussed with you? And I'm talking about working with someone who already has diabetes. And many of the time, no, they're not told how to eat correctly. I'm not saying that all the time, but oftentimes they're not given that guideline. So we really do. We have to start with a diet, and we want to encourage them to eat a cleaner diet, obviously cut out the refined sugars. And really, we can start simply with getting rid of the sugars in the liquid form. Look at the soda, look at the juice intake, but have that conversation with them What we can also do is, as you're taking this assessment, maybe now you're getting some other testing done, while you're waiting for that to come back, have them work on that diet to get them to that next step, which allows you to address the glands, add in some exercise, maybe add in some supplements that will take them to that next level, but will encourage them because of the results that they're getting, because you will be effective. But you have to start first with the diet. And I know that Dr. Hemmer did an excellent job going through the phases of care in last week's webinar. So if you missed it, definitely go back and watch the replay at transformwellness.org and get a refresher of how we can work them through these different phases of care. But again, it has to start somewhere, and the place it has to start is with their diet. What's behind this? What's behind blood sugar dysregulation? We know that it affects multiple glands and body systems that are trying to maintain homeostasis and trying to maintain normal blood sugar levels. This is actually critical as far as the body's concerned. If you want to say it, it's actually kind of obsessed with it. So when glands, organs, and body systems, they become tired or injured, we'll start to see specific symptoms come out of that. Here are just some of the common blood sugar related issues. We have obesity. I feel bad because sometimes the patient that's overweight, they're just told, well, you need to exercise more, you need to move more, as if it's just simply calories in versus calories out. And it's just not true. It has a lot to do with the type of calories. And I think we've sort of had the wool pulled over our eyes with how much sugar we're actually getting in, that I do believe this ties back into the obesity epidemic. It's the type of calories that we eat that matters most. If it didn't matter, we could all choose to eat a donut diet of X amount of calories that we've decided our body burns. Let's say I burn 1,500 calories a day, so I eat donuts up to 1,500 calories a day. That's insane. You all know that that's not possible to do. I would get really sick really quick. And that's an important thing for our patients to understand. I love using that analogy because as much as they might go, yeah, let's eat donuts all day, they just know that that's not right. But they get it in other places that seem acceptable. The all fruit juice drinks, the excessive pasta, the excessive refined carbohydrates, but because it's not a donut, it somehow seems more acceptable. With sugar comes inflammation. So sugar that's out of balance or that's excessive comes the inflammation. And that's where the chronic pain comes in. And the chronic pain, can then be stimulated by the sugar. So it actually creates a vicious cycle that, takes them down an abnormal pathway. What about cardiovascular stress? We know that excessive sugar that stays in the bloodstream is damaging to those smaller capillaries and arteries and vessels. And that's where that stress comes in. And it starts at the smallest ones. So what we're talking about here is that stress in those more distal places. We don't want to wait until it gets into the main arteries in the heart and has the potential to cause some serious damage. But that stress, that insidious aspect of just a little too much sugar is really there. Increasing hormonal imbalances. Our hormones play a big role in regulating our blood sugar. And some hormones, if they're out of balance within, I'm going to call it the steroid hormone family, can aggravate the sugar sensitivity or aggravate the sugar cravings. And you might be dealing with that. You might have someone whose sugar cravings and sugar instability is being stimulated by a hormonal imbalance. And hormones can be way stronger than any diet. So you have to understand, how are we going to clear that out? How are we going to balance that to give that person the best optimal chance to find balance and health and vitality? And with all of these, actually can come in immune compromise, where the immune system gets compromised by these imbalances. And it's very easily seen when we're dealing with chronic pain, and we're also dealing with chronic hormonal imbalances that dysregulate the immune system. Another thing I wanted to bring up before I go on, when I was thinking about this with the increasing hormonal imbalances, is going back to the obesity. Because when we are overweight and we have more adipose fat, we store hormones in that fat. And that can be another trigger behind this. So we have to have an overall understanding of these glands, and we're going to take it further in the next couple webinars about this. But what are the jobs? How do they work together? Let's look at, the pancreas, the liver, the adrenals, and so forth. So what needs to change? Clearly, the practitioner has to have an understanding of the role in regulating blood sugar, but we also need to explain it to the patient. They need to understand it's not just insulin in the sense that it's only their pancreas. They need to understand the involvement that the liver has, that the adrenals have, and how does muscle tissue play a role, or what is the information that it's telling us? Because everything in this system that's run under this endocrine system, which the pancreas is part of, the adrenals are part of, the liver is part of our clearinghouse, they all communicate with each other. They all interact and communicate with each other. So it's important to have a basic understanding and sharing that with our patients as well. So the pancreas, as we know, is an organ of digestion. Or maybe not everybody knew that, but it is so much more than just about the hormones that it produces. It produces enzymes, multiple enzymes, based on what we're taking in. But one of the primary enzymes it does make is enzymes to break down carbohydrates. It's not the only ones, but that's primarily what it will do as well. It also produces the hormones insulin and glucagon. Now, insulin is to store fat and sugar and inhibit protein breakdown. Glucagon releases sugar and fat, stores and promotes protein breakdown. You see, they have different roles. And when it comes to blood sugar regulation or maintaining blood sugar levels, those two hormones have to be in balance with each other. When they start to get out of balance is when we start to actually have some issues. When we're looking at the pancreas seems more tired, some of the statements we might get back from the endocrine stress survey, increased sugar cravings anytime during the day, might actually see undigested vegetable matter in the stool. And that's one of the things we got to look at is the bowel function and what the bowels look like. Compromised energy production, highs and lows, frequent urination. This can be an early sign of increasing insulin resistance. We know it's a definite issue when someone has gotten to that point of type 2 diabetes, but we're looking again for the early signs that could come into play. Sleepiness after eating. Someone who feels better when they eat, we're going to talk about is more like hypoglycemia, and then they can feel worse after they eat, can be a sign of more hyperinsulinic issues. Now, the liver is the main hormone and toxin detoxifier. So its job is it has a role in regulating blood sugar, but it also needs to clear out excess toxins and hormones. So remember when we talked about those hormonal imbalances can affect our blood sugar, we have to think about the liver and its ability to clear that out. Now, glucagon in particular acts on the liver to cause the glycogen breakdown, which will increase blood glucose levels. But if the liver can't accumulate and break down glycogen, then we're going to start to have problems. And a fatty liver can result in type 2 diabetes, toxic overload, because that gives the liver more than it can do. I mean, it does an amazing job, but if we keep overloading it with excess toxins, excess hormones, it's going to struggle more and more to function at its optimal level. Now, fructose and the liver. I wanted to bring this one in so that we can understand, especially things such as high fructose corn syrup or high fructose foods can have an impact on our liver, because fructose is not metabolized by the pancreas. Insulin does not have an impact on fructose. That is done by the liver. Now, the process of which it's done by is phosphorylation, and the liver converts carbohydrates to fat. But when we see elevated triglycerides on a lab test, this is where we want to think about fructose. Another thing is fructose drives up serum uric acid. This alone is an independent risk factor for type 2 diabetes, which is another value we could look at on blood work. But fiber actually slows the absorption of fructose to allow the liver to handle it, to keep the liver from getting overwhelmed. And it's another one we could have a whole conversation about. If you looked at people's diet, how many people's diet is depleted in fiber, or they don't get enough fiber. And if we're going to take it one step further and looking at processed foods, they're robbed of fiber, have very little fiber in it, because Fiber slows down the cooking time, reduces shelf life. So the fiber's taken out. So especially if you're in a restaurant or you got your microwave foods, they will cook much faster if there's not a lot of fiber in it, and it'll last longer on the shelf. It's another way that we might not realize, not just the sugar, but the lack of fiber is affecting our overall blood sugar regulation. But I loved what Dr. Lustig has said, where he calls fiber nature's antidote to fructose. And what he's referring to there is the fructose that we might get actually in a fruit, a live, living food nutrient, food support. And it's true, because if you look at, like, say, an apple that has fiber in it, but it's a living food, it's real food, it's whole food. But nature has increased, we have naturally fiber in there, which would offset, the fructose that we're getting from that particular fruit. Way different eating a piece of fruit versus a donut, to go back to the donuts. You're all going to think I love donuts. Now, what about when the liver becomes overburdened? So here are some of the signs that we might see if we're doing the endocrine stress survey. Poor skin health, the liver spots, poor vascular integrity, way we might talk to our patient about that. Do you get bruised really easily? Have you noticed that you barely bump into something and you don't know where that bruise came from, and suddenly you have 5 on your legs or so forth? They might also have increased bloating and right side liver pain. If we're looking into the stool, we'll see floating fat particles on toilet water. Stool might actually be light colored. They could be dealing with constipation. And that could vary with some other things, but constipation is a pretty common problem. And don't forget the communication between the liver and the gallbladder. And they might have already lost their gallbladder, and so the liver is even working harder in that aspect to produce enough bile to break down fats effectively. So just little questions can clue them in, whereas they might have thought, oh, this is just part of getting older, or but my lab tests were normal. When we have these symptoms showing up, we want to pay attention, because that's our body trying to let us know that things are not quite right. Thirdly, we want to look at the adrenals. The adrenals are so important when it comes to maintaining our blood sugar. And that in part has to do with the hormone cortisol. Cortisol and blood sugar go together. And remember how we talked about that there's more than one gland that helps regulate our blood sugar. And this is where we're talking about cortisol. Now, cortisol is also our most potent anti-inflammatory hormone. This is where the chronic inflammation can also tie in. If cortisol is having to always come into the rescue to try to manage inflammation, but also results in an elevation of blood sugar, because where cortisol goes, blood sugar goes as well. This, over time, chronic issues with this can affect our blood sugar, because when cortisol elevates, it can antagonize the function of insulin. Now, it doesn't happen right away. I want to point this out. It doesn't happen right away, and I'm going to talk about this in other webinars in more detail. It doesn't happen right away because initially, if we're in a stress response or we have an injury or so forth, not only would cortisol elevate, DHEA, another hormone that our body produces in the adrenal glands, would elevate as well. And it would counter that antagonization of insulin. So where cortisol might antagonize the function of insulin, DHEA improves insulin sensitivity. So again, they balance each other out. But when it's happening on a chronic level, maybe through diet, maybe through chronic stress, through chronic inflammation, as the gland gets more tired, DHEA will be compromised long before cortisol will, because cortisol is so critical, to the point that if we didn't make cortisol at all in 3 days, we would die. So you can see here that as the adrenal glands are getting more tired, we have more increased stress, we have more poor diet and inflammation, that's going to increase blood sugar dysregulation. It will be really important that when we get past the dietary aspect, this is going to be one of the glands that we'll want to support. What are some of the clues when we're looking at the endocrine stress survey that could tell us it ties into adrenals, but also taking it back to blood sugar dysregulation? So we could have dizziness from sitting to standing. That person that, stands up fairly quickly and then, gets really dizzy, almost to the point they feel like they're going to, pass out. Or they were bending over and then they come up pretty fast, that would be another way you can ask that question. If you're a chiropractor or maybe an acupuncturist, do you notice they have to get up off the table fairly slowly or they're going to get dizzy? Could talk to them if you might see extreme hunger between meals. Here we're talking again about the hypoglycemia or the hyperglycemic. So a hypoglycemic type patient feels better after they eat. The hyperglycemic actually feels worse after they eat. Might feel more tired, might feel more bloated, just like they can't, break everything down. They tend to have salt cravings. Might also, you'll notice cortisol that's out of balance, and especially with insulin, cause central weight gain. So we start to get more of that apple shape. We start to have more weight around the belly. They can also have trouble staying asleep. This could be another sign. So that, let's say for instance, at night, once they go to sleep, blood sugar drops too low. The body will surge adrenaline and cortisol to bring that blood sugar up. Again, because this is critical that we maintain adequate blood sugar levels. So while they get to sleep, they can't stay asleep. They wake up, they're not sure why they woke up. Or it could tie into what we said earlier, the frequent urination might be another thing that we saw earlier on the stress survey. But the trouble staying to sleep could just simply tie into what we call nocturnal hypoglycemia. Some really good things to pull together that, again, our patient just may not realize what the bigger picture is of what's going on with them. And just to give you a glimpse of what we'll talk about later, which is a stress adaptation and hormone resistance. And this follows the Hans-Selye model of looking at the general adaptation syndrome, also known as GAS. But in here, I just put some points about how we could think of it when it regulates to blood sugar. So first, an alarm response. Hormones come to the rescue, so to speak. So insulin would secrete to help regulate the blood sugar spike. But the resistance starts to happen when this is, we keep asking the body to come to the rescue over and over and over. Or now think about a rescue too, when we're talking about insulin, it could also be due to a diet that's, too high in refined carbohydrates and sugar and so forth. And then the problem happens. So we start to get, in stage 2, the receptors start to get more desensitized. So we're still making the insulin. It's just not as effective. It's still kind of doing things, but not as great. When we get into the exhaustion phase, this is where receptor sites are downregulated. So they're not responding effectively. They can be occupied by other exogenous hormones. And then at this point, we can develop, type 2 diabetes. But it all can be changed. That's the beauty of this. All of this can be changed around when we clean up the diet and we do the appropriate work that you're going to learn as we go through this process. So it's kind of nice to understand the role of stress. And I promise you, we're going to talk about it more. I think this will be in the 3rd webinar when we talk about chronic stress and the chronic blood sugar issue. And lastly, muscle tissue. I know this isn't like an organ. It's not like the adrenals or the liver or the pancreas, but it does have an impact when we're looking at carbohydrate metabolism, fat, and protein. Individuals that have low muscle mass have fewer insulin receptor binding sites. And I look at it, this can be a visual clue, when we have that patient in our office, or even talking to me, have you noticed that you're having trouble maintaining, lean muscle, especially the person that's, maybe when working out. And don't let them get away with, well, I'm just getting older. Like this is just a sign of aging. And there's actually some in-office testing and some scales that you can use that will, test for, muscle mass, water content and so forth. Again, when we're talking about on this first webinar is a simple survey that we can utilize and also questions and visual clues that will help us determine where our patient is at. This is just a reminder of how our body handles blood sugar. A reminder that insulin's released with elevated blood sugar. Its job is to inject the blood sugar into the liver and the muscles for glycogen storage. But insulin can cause excess sugar to convert to triglycerides, that fat storage. That's why we would look at that as a marker. Blood sugar falls, insulin leaves the blood, and glucagon is released. Glucagon increases blood sugar. Now, this is a normal process, but if we have further ingestion of carbohydrates or refined sugars, that's going to cause a blood sugar spike. It's going to cause the insulin secretion to come in again. But it's the highs and lows, too much. And we get this imbalance that creates this cycle of increasing problems. Last is looking at how we can utilize that endocrine stress survey. And it really is a great tool, just a simple survey for us to get a better idea of where the blood sugar, the immune system, get some basic medical history, diet history questions answered, looking at the endocrine system, the pituitary, the adrenal, the thyroid, the liver, the gonads. It gives a range from hypo to hyperfunction. Then you can quickly add up the symptoms in each category to give you a better idea of the risk factors. It doesn't take very long to perform, 15 minutes or so. It's a way to create the conversation, a way to create an awareness for us to be able to help our patients and not let them be that 27% of undiagnosed diabetes. And all our registered attendees are going to receive this in the email for free. So thank you, Pete, for that. That's going to be a wonderful tool for them to get started on. So I want to thank you guys for being here, and I'm going to let Pete wrap this up, and then we'll have some time for some Q&A.
So, what'd you think? Wasn't that awesome? Feel free to share this information with your patients. Now, before we get into the Q&A, let's take a moment to put things into perspective. You had a few patients fill out the endocrine stress survey. Now, what do? Wouldn't it be awesome to speak with Dr. Annette, a functional endocrinology expert? Well, you're in luck. Receive 45 minutes with Dr. Annette Schippel to discuss cases or ask her how she is growing one of the largest functional endocrinology practices in Illinois. For only $135, you can discuss your cases with an expert that will not only provide wellness program options, but help educate you in the process. Thank you for watching Dr. Annette Schippel show us how the pancreas, adrenals, liver, and muscle tissue are involved with blood sugar balance. Catch Dr. Schippel on September 8th as she will show us how to utilize blood testing to verify your survey results and track how well your wellness program is working. Do not miss Dr. Rhonda Nelson next week on Tuesday at noon Central Standard Time for her presentation, Functional Endocrinology 101, the thyroid, adrenal, and ovarian triangle, where she will highlight the importance of a properly functioning endocrine system.